So in today's session, we're going to reveal the most effective yet overlooked way to improve your blood sugar control and metabolic health, which I think is really timely and important to talk about because as we've revealed on this podcast before, about 83% of American adults, recent analysis have shown, have some degree of insulin resistance or poor metabolic health. Now, I don't need to tell you, I'm sure your doctor has mentioned to you, poor blood sugar control and insulin resistance are linked with dementia, cancer, heart disease, increased risk for stroke, erectile dysfunction, which guys, you don't really want, right? Asthma, allergies, irritable bowel syndrome, autoimmunity, and even severe COVID-19. So this is the silent epidemic that unfortunately many Americans and many people throughout the world, it's a tsunami of metabolic disease. It's rampant. And that's why we're making this video, because a lot of people think if they want to improve their blood sugar control, they need to radically shift their diet. They can never have a glass of wine or a beer on the weekends. They must always eat clean and cut out the sugar. While that's effective, today we're not going to talk about that. A lot of people think if they want to improve their blood sugar control, they need to embark on all sorts of crazy fasting protocols, intermittent fasting, prolonged fast. They need to fast for 21 days, water only. You know what? Fasting is effective. We're not going to talk about fasting today. A lot of people think, oh, I need to improve my blood sugar health, so I'm going to go get metformin. I'm going to take berberine. I'm a fan of both of those compounds. We're not going to talk about that today, my friends. So you might be thinking, okay, well, he's dwindling down. Oh, I must go on a keto diet. Nope. As effective as keto is, we're not talking about keto today, my friends. Oh, he must be talking about sleep. Today, we're not talking about sleep or stress reduction or circadian rhythms. So what could we be talking about? We're going to talk today, my friends, about muscle and exercise. Having healthy skeletal muscle and regularly exercising is hands down the most effective way to regulate your blood sugar. And it turns out that many people that have insulin resistance have reduced ability to exercise and have poor muscle quality and atrophied or sarcopenic muscle because there's this bidirectional system. As you get more and more insulin resistant, as I just mentioned, about 50% of Medicare eligible individuals over the age of 60 have metabolic syndrome. 83% of US adults have some degree of poor metabolic health. That poor metabolic health exacerbates muscle loss, and muscle loss worsens metabolic health. This is like a ship taking on water, okay? So if you are trying to restrict your diet, and you're fasting all the time, I have no problems with calorie restriction. I have no problems with clean eating. But if you're not exercising, you're taking on water in your boat. You're taking on water because you need muscle to control your metabolic health. Because let's be real, there's going to be a birthday party. There's going to be Christmas, Valentine's Day, 4th of July, whatever, where you're going to eat something that increases your blood sugar health. Even if you eat real whole food, you're going to have increases in blood sugar in the post-meal window. You might say, well, what's the big deal? Where does that blood glucose go? You might ask. 80% of the post-meal glucose, after you eat, where does that glucose go? It goes into your muscle. 80% of that glucose goes into your muscle. Well, if you don't have muscle because you're not exercising, if you have atrophied, weak muscle that's inflamed or infiltrated with fat, it's not going to be healthy enough. There's going to be nowhere for that blood sugar to go after the meal. So what happens? It gets converted by way of lipogenesis into lipids. So you get lipid storage in organs like the pancreas, like your heart, like your liver. Let me just tell you, my friends, the three places you do not want fat to go is your pancreas, your heart, and your liver. Fatty heart, fatty pancreas, fatty liver is linked with all sorts of problems. You only have one liver and one heart, one pancreas, my friends. You do not want that infiltrated with fat. So what do you want? You want healthy muscle. Now, we're not going to turn you into a bodybuilder, okay? We're going to just focus on post-meal walking, squatting, doing things like that. We're going to talk about that. But remember that there's a bidirectional system. Poor metabolic health is linked with muscle loss. Muscle loss and poor health of the muscle is linked with poor blood sugar control. So they're two sides of the same coin. I want to, really drill this down because, again, as I mentioned in the introduction, I was very deliberate about this. When we think about decreasing blood sugar oscillations and improving blood sugar health, a lot of people think, oh, cut my carbs and increase my fasting window or increase fasting times and duration and intensity. Okay. Effective, yes. But when you fast a lot, you're not necessarily supporting muscle health and muscle quality, despite the fact that fasting has been shown to increase pulsatile secretions of growth hormone. It's not an anabolic state, my friends, okay? So just remember that. We're going to focus on exercise. It's really important. I want to continue on this road and share with you a fascinating paper that showed the intersection between muscle loss, known in scientific jargon as sarcopenia, and type 2 diabetes and some gene associations. And then we're going to talk about the specific exercises, frequency, duration, and intensity that you should consider to support metabolic health. But first, I want to welcome y'all back. As always, thank you for being here. Hopefully you're enjoying this video. If you are, hit that like button, subscribe to the channel. Please just leave a comment below, something short and sweet that goes a long way. And if you're wondering, how do I know if I'm metabolically healthy? And that's why I want to thank the sponsor of today's video, biocoach.io, the makers of an at-home, really accurate hemoglobin A1C test. We've talked about the A1C test before. This is the average level of blood glucose. It's a way to approximate your average blood glucose by looking at how much glucose has been sort of glycosylated or attached to your hemoglobin. What's great about this, my friends, is it's really affordable, and you can do this in the comfort of your own home by going to biocoach.io. Check out their A1C meter. They have a bunch of different meters you can also check out, but I want you to really focus in. If you don't know your hemoglobin A1C, you should, because a lot of people don't know that they're in metabolic debt until they actually see on a test like a hemoglobin A1C or a post-meal glucose and go, oh my gosh, I really need to make some improvements, some sweeping changes in my life. Now, it's important that you have this sort of reference point so that you know what is leading to the improvements or the regression in your progress. It's really great to know where you're coming from, to know where you're going. So you can save on this at-home test. What's unique about this is for under $100, you get part of this is there's 4 individual kits in there. So you can test once, then you can do some lifestyle change, some improvements, retest 3 months later, and then 3 months after that. Hopefully the trend is going down, meaning that your hemoglobin A1C is improving because your blood sugar health is improving and your average level of glycosylation is improving. Now, as we're going to talk about in a moment, glycosylation, which is literally the marker that you're measuring in this at-home hemoglobin A1C test, also accelerates muscle loss. Remember, muscle is a metabolic sink. Okay, if you think about muscle, after you eat a meal, you're able to survive, circumvent and navigate rough waters, metabolically speaking. You can go to that birthday party and have a piece of pizza, maybe a little bit of cake if you are insulin sensitive and you work out on a regular basis. But if you don't, you're going to take on water because a lot of post-meal glucose is deposited in muscle. So muscle gives you a little bit more flexibility, a little bit more resilience. Okay. So as I mentioned, you can save on this at-home test by going to biocoach.io, use the coupon code HIH at checkout, and I'll link that below, biocoach.io. So let's continue on and talk more about the connections here between muscle loss and diabetes. I just want to share with you this paper because it's so powerful. The title here is Identification of Shared Gene Signatures and Pathways Between Sarcopenia and Type 2 Diabetes. So as I sort of mentioned there earlier, that there's this bidirectional system between accelerated poor metabolic health, that is, and accelerated muscle loss. So there's this bidirectional system that we need to be aware of. And new analysis actually shows mechanistically why that is, because there's shared pathways that are upregulated in diabetics that lead to the muscle loss. Now you might be saying, well, I'm not diabetic yet. I'm pre-diabetic. Yeah, you're on the path. You're heading in that direction, my friends. The puck is going there. You're not there yet. So those genes could be upregulated, maybe not to the same degree compared to someone who has full insulin-dependent type 2 diabetes. But if you're insulin resistant, and again, I don't want to say this again, but I'm just going to say 83% of US adults are insulin resistant, my friends. And this is increasing in the prevalence, unfortunately, also for young people. So there's this bidirectional system. We need to work on this. What do we do? What can we possibly do here to improve this? This is where exercise really comes in. And we're going to focus in on resistance training and focus in on the legs and talk about why the legs are so important. There was one of my favorite papers from 2010 showed that in insulin-resistant individuals, people that have metabolic disease, like 83% of Americans, their leg tissue is more insulin-resistant compared to the musculature of their upper body. So I've been sharing this finding in this research study. Check it out on the screen. We'll put links in the show notes. This article really changed the way I think about exercise and walking and movement and structuring my exercise programs because growing up, I'm sure a lot of you, men especially, when you start getting into exercise, you're focusing on your upper body. You're focusing on your chest and your arms and your back and all of this. Well, remember, your legs should contain about 2 times as much muscle compared to your upper body extremities. I recently did my body fat analysis and so forth. Look at just one leg. It has almost 2.5 times more muscle compared to one arm. So look, if you're short on time, like everyone is, like people say, well, I don't have time for exercise. I have 3 kids. I have 2 jobs. I have this. Okay, but we're all very busy. If you're short on time, focus on your legs. Hip hinges, squats, lunges, hip thrusts, deadlifts. There's a million and one things. You need to hire a trainer, someone that can create a program for you to focus on the musculature of the legs, because it turns out, we always talk about, ancestral nutrition and living like our ancestors and so forth. Your ancestors didn't have a car. Your ancestors didn't have a desk. They didn't sit. They didn't have a couch. They moved. They walked. So it turns out, due to the fiber type in the legs and the lower extremities, they depend on a lot of activity. And if that activity is not present, then guess what? We see the onset of these metabolic diseases, which, as I've mentioned, are quite rampant. So my friends, here's what you do, sort of in summary, and I'll share with you exact specifics on this in a moment, what various studies have actually found. But you need to walk after major meals, okay? It can be 5, 7, 10 minutes, okay? Various studies have shown that, again, as I mentioned, you can actually have crappy food. And I did this experiment back in 2018. I went to a vegan restaurant. I had, because vegan food is inherently higher in carbohydrates compared to like a steakhouse, right? Went to a vegan restaurant, had a very high glucose. It was one of the first times I wore a continuous glucose monitor in 2018. And I went for a brisk walk, and I saw it almost shifted it was like 45% reduction going for a brisk walk. So friends, bake it into your activity. Now you might be saying, why eat dinner at 11 o'clock? It's dangerous outside. I live in Brooklyn or wherever. Okay, eat dinner earlier. Go for your walk after dinner. Now you might say, well, does it have to be 29.7 minutes after my dinner or 37.6 seconds? Look, it doesn't matter, my friends. Just go for a walk within the 90-minute window after your meal. Okay, so it doesn't have to be 37 minutes and 2 seconds. It just sometime within the post-meal window, because that is the time that your blood glucose is going to be highest, in the 90 minutes after you eat a meal. Remember, just want to say it again, about 80% of post-meal glucose is actually deposited in skeletal muscle. If that muscle is atrophied, if that muscle is weak, if that muscle is sarcopenic, if that muscle is infiltrated with fat because of metabolic disease, you will reduce the ability and the probability of that post-meal glucose to be deposited in that metabolic sink, and your boat, your ship is taking on water, okay? 1 meal, you can take on a little water. 3 meals a day plus snacks every day for 40 years, your boat is going to sink. And what that sinking means, peripheral vascular disease, diabetic foot issues, erectile dysfunction, cognitive decline, cancer, asthma, the list goes on, okay? So prevent your metabolic boat from taking on water by going for walks after meals. Do it as a family. We do this every single night, my friends. So you're walking with your family, you're talking, it's all good. So we got to do that. Now let's focus on the training specifically. What I suggest to people is do the training that works for you. I happen to really enjoy resistance training. Some of you listening might hate resistance training. You might despise it. You might have this association with gym is linked with meatheads. You're going to get hit on and you don't want to go to the gym. Okay, do the exercise that you like. If you like to garden, you can make gardening an exercise. I do this all the time. Like if I'm moving dirt with a wheelbarrow, I'll try to sprint or go as fast as I can to get my heart rate up. Just, make it fun for you. Do something that you enjoy, because when you enjoy it, you're going to want to come back and do it more and more and get better and better at it. I will share with you some of the studies. There's 2 more studies we're going to talk about, and then we're going to talk about the prognostic significance of low muscle mass as we finish off, as it's linked with metastatic cancer, which is insane. Okay. But I have 2 papers here that were recently published in the last several years. The title of this one is Increased Insulin-Stimulated Glucose Uptake in Both Leg and Arm Muscles After Sprint Interval and Moderate Intensity Training in Subjects with Type 2 Diabetes or Prediabetes. Okay, so even if you have insulin resistance, or as the title mentioned, diabetes or prediabetes, you can still improve the insulin sensitivity of your muscles by just doing, wait for it, 6 exercises over the course of 2 weeks. Okay, I know what everyone says, I don't have time. Do you have time to reduce the prevalence of cancer, heart disease, dementia, erectile dysfunction, vascular disease, kidney disease, all the, depression, all this? If you could just invest 6 10 to 20 minute sessions over the course of 2 weeks, I think you can make the time to do that. So short duration, high intensity interval training between 30 seconds and 1 minute, 5 to 6 sets that are pretty intense for 30 seconds to a minute, spread out over the course, within one exercise session, 5 or 6 sets that are lasting between 30 seconds and a minute, spread out over the course of 2 weeks, has been shown to dramatically improve blood sugar control even in type 2 diabetics. There was another study just doing one-legged exercises in patients with type 2 diabetes, just one leg, training one leg on a bike. Okay, they were doing bike intervals. How long was this was 10 1-minute exercises on the bike with one leg at 80% max heart rate. Okay. So this was 1 minute and then there was a break 10 times. So it's probably a 20-minute exercise session in total, but it was just several over the course of 2 weeks. I think it was, how many times did they do this? I want to say it was like 4 times over the course of 2 weeks. This is not every day, my friends. That's the important point. But you got to get your legs involved. I think that's when it comes to ROI from a metabolic health standpoint and lowering your blood sugar, like how we introduced this conversation about the importance of that. It needs to focus on your legs. Now, it doesn't mean that you can't train your upper body. There's a lot of good reasons to train your upper body, but it's a lot lower in terms of overall muscle mass containing compared to the lower body. And here's the other important thing that I want to finish off on, then we'll talk about cancer. As you age, especially postmenopausal women, you lose muscle mass in your legs. Now remember, your legs, just one leg in a healthy person contains about 2.5 times more muscle compared to your arm, right? So it's really important that we understand that muscles in the lower body contribute a lot. They have the most ROI. So focus, try to hit your legs from a push-pull hip hinge movement 2 days a week. That's what I suggest. And I'll link a video that I did with my own personal trainer, Dan Stephenson. I also train at this gym here in Kirkland. It's called F3 Functional Fitness. I'll link some videos there so you can sort of check that out. That's a combination of full body movements, more functional based, but getting your legs involved. Remember, your legs evolved. Your ancestors used their legs a lot. Your legs are a big metabolic sink, a sponge, so that when you go off the rails, because it's going to happen, you're going to have one too many glasses of wine. You're going to have grandma's cookies. Your blood sugar is going to go up. And if you have the muscle to act as a buffer to guard against a supraphysiologic level of glucose, that's going to be a good thing, my friends. And this is probably why these fitness models and these fitness competitors, you see them, they're eating cupcakes and donuts and all, they eat like crap, right? But they have so much muscle mass and they're training so intensely that they might later on in life get the diseases linked with that, but you don't see that reflected negatively oftentimes in their blood work or their body composition, okay? So exercise, to finish off, is one of the most effective ways to improve and regulate your blood sugar control, especially when you walk after a meal, just like a brisk or moderate paced walk after you go out and eat. Don't worry about, at what point in time you ate, just within the 90-minute window is best. And try to resistance training several days per week. Try to hit every major muscle group once per week. This can be at home. Body weight exercises. Check out Brett Contreras' book, Glute Lab. I will link other videos there as well. And periodically, several days, 2 to 3 days a week, maybe on days that you don't resistance train, throw in some high intensity interval training. Try to ramp up that intensity to a relative perceived exertion about 8 out of 10, meaning like, man, I could do a little more, but I'd be really pushing it during that interval. Those intervals they'll vary based upon the day. Maybe they last 15 seconds one day, 45 seconds another day. Some days they're all out for 5 seconds. So those are really important to consider. Now, last but certainly not least, this paper just came out earlier. I think it was this month or end of February. The title here is Prognostic Significance of the Skeletal Muscle Index and Systemic Inflammatory Index in Patients with Lymph Node Positive Breast Cancer After Radical Mastectomy. Okay, so basically what the study found is skeletal muscle quantity, and they also had this approximation for the amount of inflammation that's in the muscle is linked with poor outcomes with breast cancer. That is, higher levels of skeletal muscle, but lower levels of inflammatory indices within that muscle correlate with better prognosis after breast cancer. And that's important because breast cancer is the number 2 leading cause of mortality, even amid all this respiratory virus health crisis that we've been hearing about over the past 2 years. Still was the second leading cause of mortality. Heart disease was, of course, number 1. There was also a study here. So remember, cancer is a disease of the immune system, essentially. I mean, there's metabolic elements as well, but also asthma and other inflammatory diseases that harm people and compromise quality of life are linked with metabolic health and muscle health as well. This study found that muscle mass within the legs was inversely correlated with asthma symptoms in women, but not muscle mass in the upper body. So there's something, I know I'm biased here. There's something unique, metabolically speaking, and immunologically speaking, about the legs, and the muscle quality and tone in the legs offer some sort of protective benefit that seems to be a little bit better from a longevity standpoint and chronic diseases that are common amongst Westerners. So keep that in mind, be aware of that. So go out there, learn new leg exercises, follow Brett Contreras, follow Dan Stephenson over on Instagram, learn how to hip hinge, learn how to lunge, learn how to do hip thrusts, learn how to squat, learn how to, there's so much that you can do, leg press, compound movements to support that muscle quality within your legs. So my friends, as always, thank you for tuning all the way in. Hopefully you found this helpful. If you did, please share this video, send this as a direct text message to a friend that you care about to encourage them that, yeah, we need to eat a little bit better. Yeah, we could benefit from fasting, but most importantly, we need to move those muscles because muscles are a metabolic sink. They allow our body to take on a little bit more water, metabolically speaking, and we can cruise and navigate through life where we're going to be constantly inundated with hyperpalatable, hyperglycemic junk food. So we need to have that potential, that metabolic potential from muscle, and it's really important. So hopefully you found this video helpful. We will catch you on a future one down the road. Bye now.